Hello dear students, welcome to GDC English classes. So you know about GDC Gpat Discount Center since 15 years that only GDC teaches classes in Hindi only. No, because of especially for South India region students from pharma background to break language barrier. So GDC launches GDC English classes since 1 year. So you all are following. Thank you so much for your response, your interest, your enthusiasm, your passion towards the pharma field as well as towards the GDC platform. So if you are really enthusiastic about to achieve your goals, so GDC is always with you. And one of the great news is so most of the students receiving their stipend who qualified Gpat 23 as well as 2024. I hope who are watching this video already qualified in Gpat in 23-24. They also received their money. So don't worry if not received also, you will get your money. So since many days GDC is telling that yes, you will get the stipend, maybe because of some reasons it is delayed. But your hard work is never failed. So GDC is always telling that and today is also happened. So always students will trust in GDC because of quality as well as content. So anyway, so in this session, we will discuss about pharmacology questions with explanation from previous year question paper GPAT 2021. I hope you are too busy with your preparation, but this is the time. Always follow the previous year question papers along with explanation how they are asking questions, from which topic they are asking questions. So definitely this video will be helpful to you. So only thing in these 3 days, what you are studying for 1 hour, 2 hour, just to close the books or something and revise the things. So be stabilize yourself, don't excite, don't depress, stabilize yourself, be yourself, be patient. Definitely everything is coming in the positive way towards your side. So these last days are very, very crucial. So going into forward our session. So regarding the first question, what is the first question here I mentioned? So regarding the first question here, condition, a condition in which there is a severe loss of extracellular fluid ECF due to hemorrhage, nothing matter, loss, blood loss, and diarrhea, severe vomiting or sweating, followed by shrinkage of blood volume, reduction of venous inflow to the heart, reduction of cardiac output and fall of the blood pressure is known as. I hope you already know that answer. So by studying this condition, simply here there is a continuous loss of fluids from the body, continuous bleeding. So excess loss of fluid from the body decrease the blood volume or body volume, sorry, blood volume as well as body fluid volume. So that's may generally leads to the hypovolemic shock. That is generally leads to the hypovolemic shock. So condition in which severe loss of extracellular fluid due to hemorrhage, diarrhea, severe vomiting or sweating, followed by the shrinkage of blood volume, reduction of venous inflow to the heart, reduction in the cardiac output, fall of blood pressure is known as simply the answer is you know that simply hypovolemic shock is the answer. The shock is because of a rapid decrease in the blood body fluid volume or blood volume. So let's have a look on the explanation. So regarding the explanation, what is hypovolemic shock? Result from the inadequate circulatory blood volume by various ecological factors that may be either from the loss of more than 15% of body fluid due to blood loss or dehydration. So decrease in body fluid volume leads to hypovolemia, reduction in the fluid volume. That is because of severe blood loss, severe fluid loss, or because of dehydration. There are different reasons will be there. It may lead to the organ failure, decrease in the blood volume, body fluid volume may lead to organ failure. Excessive use of diuretics also may lead to this condition. So diuretics are nothing but these are the substance increase the urine formation. They increase the elimination of fluid from the body, especially in hypertension and edematous condition. But excess usage or continuous usage of diuretics may decrease the blood volume, nothing but fluid volume in the body and may develop hypovolemic shock, hypovolemic shock. And what is a cardiogenic shock? What is a simply cardiogenic shock? So regarding the cardiogenic shock, it is acute circulatory failure with sudden fall in cardiac output from acute disease of the heart without actual reduction of the blood volume, without actual reduction of the blood volume that result in the cardiogenic shock. So a sudden fall in the cardiac output, sudden reduction in the cardiac output. So For each beat, a sufficient amount of cardiac output is coming from heart to outside of the heart to sending to the body parts. So decreasing body parts, decreasing blood circulation to the organs, and it may lead to decrease in the function of other organs also. So that is cardiogenic shock. Next. So what is septic shock? So what is simply septic shock? So regarding the septic shock, also known as toxemia, septic shock, severe bacterial infection or septicemia induces septic shock. So overload of bacteria in the blood may develop septic shock, septicemia, toxemia. Deficiency of adrenal gland function and vasopressin production occurs in about half and one-third patients respectively. So generally, in case of here septic shock, there is a deficiency of adrenal gland function as well as decrease in vasopressin function. Next, what is anaphylactic shock? Anaphylactic shock is nothing but a severe form of allergic reaction, especially because of increase in IgE production as well as histamine function. Anaphylactic shock, also known as a severe allergic shock, treatment by using adrenaline, glucocorticoids as well as antihistamine. So these are the different types of shocks. So what is the next MCQ here? So wheel and flare. So wheel and flare reaction, characteristic reaction associated with the identification of type 1 hypersensitive reaction, type 2 hypersensitive reaction, type 3 hypersensitive reaction, type 4 hypersensitive reaction. So adverse drug effects, in adverse drug effects you will study hypersensitive reactions or allergic reaction. So in that wheel and flare commonly observed in case of type 1 hypersensitive reactions characterized by increasing IgE antibody function as well as increase the function of histamine, prostaglandins, platelet activating factor, etc. They increase the edema. Due to edema, there is a redness, swelling, like that is there. So wheel and flare characteristic features of edema characterized by redness, swelling. So this wheel and flare are characteristic features of type 1 hypersensitive reaction. Type 1 hypersensitive reactions are also known as immediate reactions. Type 1 hypersensitive reactions are also known as immediate reactions. So let's have a look on the explanation. So regarding the explanation, so answer is a type 1 hypersensitive reaction. So here there are nearly 4 types of hypersensitive reactions. Type 1 hypersensitive reactions, also known as anaphylactic reaction, highly allergic reactions. As we mentioned, wheel and flare characteristic associated with the type 1 hypersensitive reaction. It is mainly mediated by the IgE antibody, one of the antibody, IgE antibody. And it is occurs within the minutes of exposure. These are the immediate reaction. And there is involvement of histamine. Histamine dilates and increase the permeability of blood vessels and increase the accumulation of fluids in the blood vessel. May forms angioedema. And the prostaglandins cause contraction of smooth muscles of respiratory system, increase the mucus secretion. Leukotrienes also causes bronchial spasm. So type 1 allergic reactions are characterized by wheel and flare. Characterized by type 1 reaction. I hope here you are seeing the Gpat mantra. So recently GDC releases second edition of Gpat mantra. It is containing nearly 35 previous years of question papers with explanation in detailed manner. So apart from that, so you must go through the previous year 2024 Gpat question paper from this book because from 2024 the board is changed. NBMES board is giving the Gpat exam paper. It is a medical board. So generally they focused on the medical related questions in the previous year. I also surprised. So please once you already go through also. Once you go through that previous year 2024 Gpat question paper from which subject how many questions are came. So please go through it 125 questions. Definitely it will give you some idea. Okay. Next, type 2 allergic reaction. Type 2 allergic reactions are also known as cytotoxic reaction. They are also known as cytotoxic reactions. They involve by IgM antibody. And type 3 are known as immunocomplex reactions. They mainly involved by the IgA antibody. Next, type 4 allergic reactions are known as cell-mediated reaction. There is involvement of T cells. There is involvement of T cells. Type 4 allergic reactions. Type 4 allergic reactions. Okay. So like this, there are different types of allergic reactions like type 1, type 2, type 3, type 4 allergic reaction. Type 1 are immediate reaction. Type 4 are delayed reaction. Type 4 also known as cell-mediated reaction. Cell-mediated reaction. Cell-mediated reaction. So going to the next MCQ. So regarding the next MCQ, the immunosuppressant action of cyclosporin. So the question itself telling cyclosporin is an immunosuppressant. Immunosuppressants are commonly used in case of autoimmune disease as well as during the organ transplantation. So during this condition, there is a chance of excess functioning of immune system. To suppress excess functioning of immune system during treatment of autoimmune disease, especially in the condition of autoimmune disease and during organ transplantation, the drug is useful. So the immunosuppressant action of cyclosporin. So they directly asking cyclosporin mechanism of action. Interfere with antigen recognition, inhibition of gene transcription of interleukins, blockade of tissue response to inflammation, inhibition of cell wall synthesis, inhibition of the cell wall synthesis. So mostly cyclosporin is a immunosuppressant and it is interfere with the transcription of the interleukins. Transcription of the interleukins. So interleukins are one of the immune system elements may elevate the immune system function and may lead to development of autoimmune disease and also may oppose the organ transplantation surgery. Organ transplantation surgery. So that is the answer. And let's see the explanation regarding the mechanism of action of cyclosporin. Regarding the mechanism of action of cyclosporin, cyclosporin enter into the cells and forms a complex with calcineurin binds to calmodulin. A calmodulin is a calcium dependent protein. A calmodulin is a calcium dependent protein and the cyclosporin binds to calcineurin and forms a cyclosporin calcineurin complex. The cyclosporin calcineurin calcineurin complex inhibit the T cells production, and decrease the cell mediated immunity. So cyclosporin inhibit the T cells production and decrease the cell mediated immunity. Okay. So regarding especially, so it inhibit the T cell activation and interleukin 2 production. Inhibit the T cell activation as well as interleukin production. The end result is decrease in interleukin 2, which is a primary chemical stimulus, increasing the number of T lymphocytes. So decreasing T cells due to decreasing interleukin 2 production, decreasing T cells decreases cell mediated immunity. So cyclosporin is immunosuppressant inhibit the interleukin 2 production by the decrease of T cells production. Okay. And next, in healing of excised wound, there is a less tissue loss, less inflammatory exudate, less necrotic tissue to be removed, as well as more granulation tissue is required. So regarding so in healing of excised wound, there is a more granulation tissue is required. So granulation making a healing process faster. In healing of excised wound, there is a more granulation tissue is required. So the answer is D. And regarding explanation in wound healing, what is happening? So this is a process takes place in the wound healing. So this is a day 1 process of inflammation. This is a day 3 to 7 and here it is a day 30. So there is a total healing. So here injuries happened and slowly the repair healing is started here and it is leads to the granulation formation and finally it leads to wound healing. So let's have a look here. Wound healing, there is a formation of granulation tissue due to proliferation of fibroblast neovascularization from the adjoining viable elements. So in wound healing, what is happening? Proliferation of fibrous tissue, proliferation continuous division of cells of fibroblast, and neovascularization, increasing the blood supply to the new tissue, increasing the blood supply to the new tissue. So next question, a 3-year-old child presented to OPD with the symptoms of influenza. Aspirin is contraindicated in patient because of increases risk of, so a 3-year-old child presented to the OPD with the symptoms of influenza, a viral infection. Aspirin is contraindicated in this patient because risk of gastric bleeding, thrombocytopenia, Fanconi syndrome, Ray's syndrome, Fanconi syndrome as well as a Ray's syndrome. So this question is especially, that's why don't combine antiviral drugs with aspirin. Don't combine antiviral drug with the aspirin. Okay. So generally, gastric bleeding is also risk of excessive use of aspirin, and thrombocytopenia, reduction in the thrombocytes. Fanconi syndrome generally observed with the tetracyclines due to use of expired, outdated tetracycline, expiry date of drugs. And Ray's syndrome is the answer. So Ray's syndrome, because of increasing the risk of Ray's syndrome, so there is a chance of observation of this risk. So that's why don't combine aspirin along with the antiviral drugs, especially for treatment of influenza. Okay, so here let's have a discussion. Ray's syndrome typically occurs after viral illness, particularly an upper respiratory tract infection, influenza, varicella, or gastroenteritis, and associated with use of aspirin during this illness. So don't use aspirin during this influenza, and don't use aspirin plus antiviral drugs. They increase the risk of Ray's syndrome. It is characterized by occurs after a viral illness, particularly damage the upper respiratory tract, causing infection, influenza, and including gastroenteritis, inflammation of the GAT layer. Okay, so what are the general adverse effects of aspirin? Asthma, salicylism, excessive dose of aspirin, peptic ulcer, ion uncoupling or platelet disaggregation, Ray's syndrome, idiosyncrasy, noise. All these are the adverse effects of the aspirin. Next, conversion of T4 to T3 inhibited by. So T4 to T3 conversion should be inhibited by drugs like anti-thyroid drugs, useful in especially in hyperthyroidism, condition. So propyl thiouracil, radioactive, low solution, carbamazole. So conversion of T4 to T3 inhibition is associated with. So propyl thiouracil. So T4 is the pro form of the thyroid hormone. That is T4 is converts to T3. That is T4 is converts to T3. T3 is the active form of thyroid hormone. But conversion of inactive form to active form inhibited by the propyl thiouracil, anti-thyroid drug, propyl thiouracil. Yes, the answer is the propyl thiouracil. It is an anti-thyroid drug. So this is the different steps involved in the thyroid hormone synthesis, like iodine trapping, oxidation, because oxidized iodine only can involves in the thyroid hormone synthesis. And after that, coupling reaction to form a T3, T4, and after that, storing of iodine, and after that, released when required, and T4 is converted to T3. T3 is the active form. And drugs like, especially drugs like propyl thiouracil, propranolol, amiodarone, glucocorticoids, they may inhibit the conversion of T4 to T3. So inhibit the conversion of T4 to T3 by propyl thiouracil, especially tetrahydrothyronine 5' deiodinase by inhibition of tetrahydrothyronine 5' deiodinase deiodinase enzyme inhibited by propyl thiouracil. So these are anti-thyroid drugs used in the treatment of hyperthyroidism. The next question is here. So regarding the next question, hemophilia A is caused due to reduction in the quantity or activity of which of the following clotting factor? Hemophilia, a genetic related clotting disorder, bleeding disorder, especially due to vitamin K, clotting factor 4, clotting factor 8, clotting factor 9. So I hope you already know that the clotting factor 8 is known as anti-hemophilic factor. So sufficient amount of this clotting factor in the body decrease the hemophilia, a genetic disorder responsible for the bleeding, hemorrhage, severe hemorrhage. Deficiency of clotting factor 8 or anti-hemophilic factor may causes hemophilia. So like these questions on clotting factors appeared in the many times. The answer is here simply clotting factor. It is the answer, that is anti-hemophilic factor. So this is the table. So simply factor 1, factor 2, factor 3, factor 4, 5, 7, 8. So 8 is known as anti-hemophilic factor. Co-factor involved in activation of factor 10. Deficiency of this clotting factor develops hemophilia A genetic related bleeding disorder. So there should be sufficient amount of clotting factor 8 and even vasopressin derivatives, vasopressin agonist, they also increase this anti-hemophilic factor. So vasopressin analogs like desmopressin also for treatment of hemophilia. Vasopressin analogs are agonist, desmopressin also for treatment of this hemophilia. Yes, next factor 9, 10, 11, 12, 13 and their names and their actions. Next. So regarding the next MCQ. So let's have a look on the next MCQ. So the question is here, a hypertensive patient Mr. Z already receiving a drug X to control his blood pressure was prescribed a tricyclic antidepressant. This resulted in the abolition of the antihypertensive action of X. Which of the following drug could be X? So simply here, a hypertensive patient already receiving some drug that is named as X to control his blood pressure was prescribed a tricyclic antidepressant. This result in the abolition of antihypertensive action of X. Which of the following drug could be the X? So generally, enalapril, captopril, these are AC inhibitors. Clonidine, a alpha 2 receptor agonist, decrease release of subpharmaceuticals, and etenolol as well as a diltiazem. So here he may be prescribed by the tricyclic antidepressants. Generally, what tricyclic antidepressants will do? Tricyclic antidepressants will increase the monoamine levels. So increasing monoamine levels may increase the blood pressure. That may interfere with the action of the clonidine. So clonidine is a sympathomimetic agonist the alpha 2 receptors in the CNS. By agonism of alpha 2 receptors in the CNS, decrease the release of noradrenaline. Decrease the release of noradrenaline will control the blood pressure. But here, using of tricyclic antidepressants may increase the levels of noradrenaline. Increasing noradrenaline may increase the blood pressure. Instead of decreasing blood pressure by clonidine, there is an increasing blood pressure by using tricyclic antidepressants. Tricyclic antidepressants may increase the blood pressure, but clonidine decrease the blood pressure. Answer will be the clonidine. Let's see the explanation. You will understand. So the Z already receiving clonidine to control blood pressure was prescribed a tricyclic antidepressant. Clonidine is a partial agonist with high affinity, high intrinsic activity at alpha 2 receptors in the CNS, especially alpha 2A subtype in the brainstem. Tricyclic antidepressants and chlorpromazine abolish the antihypertensive action of clonidine, probably by blocking alpha 2 receptors on the clonidine acts. Generally, agonism of alpha 2 receptor decrease the noradrenaline, decrease the blood pressure because alpha 2 receptors are autoreceptors. Activation of autoreceptors decrease the release of neurotransmitters. But these drugs like tricyclic antidepressants, chlorpromazine, they block the alpha 2 receptor. Blocking or antagonism of alpha 2 receptor increase the noradrenaline. Increase the noradrenaline may increase the blood pressure instead of controlling blood pressure. Alpha 2 receptor agonist chlonidine decrease the blood pressure. Alpha 2 blockers may increase the blood pressure. Next. So let's have a look on the next MCQ. Which one of the following that is not absorbed orally? It is not a bronchodilator, does not have any direct effect on the smooth muscle at effective in antigen induced, exercise induced, and irritant induced asthma. Do not all asthmatic respond to positively. Not asthmatic response positive. So which of the following drug is not absorbed orally, not having good absorption orally? It is not a bronchodilator, does not cause dilation of bronchial smooth muscle, not have any direct effect on the smooth muscle at effective in antigen induced, exercise induced, and irritant induced asthma. So not all asthmatic respond to it positively. So salbutamol, generally you know that salbutamol is a bronchodilator, it dilates the bronchial smooth, and montelukast, jafilucast, cystinyl leukotriene antagonist. They decrease inflammation in asthma. And terbutaline is also a bronchodilator, dilates the bronchial smooth muscle. So answer is the sodium chromoglycate. Sodium chromoglycate is a mast cell stabilizer. Stabilize the mast cell. Sodium chromoglycate is a mast cell stabilizer. The answer is the sodium chromoglycate. Regarding the explanation, so yes, we know that all these are bronchodilator, beta 2 receptor agonist, methylxanthines, anticholinergic. So beta 2 receptor agonist, agonism of beta 2 receptor control the asthma. Blocking of muscarinic receptors also control the asthma. And methylxanthines, theophylline also dilate the bronchial smooth muscle, helps in treatment of asthma. And leukotriene antagonist, maltolic acid, jacobic acid, mast cell stabilizer, sodium chromoglycate to ketotifen, and corticosteroids. So, improper treatment of asthma may develop to severe inflammatory asthma. The severe inflammation in asthma can be controlled by using glucocorticoids, because glucocorticoids are potent anti-inflammatory drugs. May decrease the severe inflammatory asthma also, may control the severe inflammatory asthma also. So sodium chromoglycate, also known as cromolyn sodium, not absorbed orally, poor absorption from the GIT, not a bronchodilator. It is not a bronchodilator, does not having any effect on the relaxation of bronchial smooth muscle. Sodium chromoglycate does not having relaxant effect on the bronchial smooth muscle, and it is effective in the asthma because of antigens, asthma because of excess exercise, asthma because of any irritants like allergens, some other irritating substance of this bronchial smooth muscle or esophagus, nothing but trachea also. Next, have a look on the following MCQ. Which of the following is not a endogenous opioid peptide? So, exogenous opioid is morphine. Exogenous means outside, naturally from the plant source. Morphine, terpene, codeine, some synthetic, some is natural, semi-synthetic, synthetic derivatives of that. Natural morphine, semi-synthetic heroin, and synthetic drug, even many examples are there, like synthetic opioids also there. Pethidine example is there. So here, which of the following is not an endogenous opioid peptide? Not a endogenous opioid peptide. Met-encaphalin, leu-encaphalin, dinorphin, beta-lipoprotein. So, encaphalin, so dinorphin, so these are the endogenous opioid peptides present in the body. They produce a morphine-like action, produce pain relief. For example, I am standing continuously for 1 hour, I will get the pain, but after rest I will feel free of pain because of this endogenous peptide. So among this, beta-lipoprotein is not an endogenous opioid peptide. These are also known as endorphins. Endorphin, morphine-like substance cause pain relief, produce feeling of happiness by reducing the feeling of pain, by reducing the feeling of illness. So simply the answer is option D. Option D is the answer. It is not an endogenous opioid peptide. So endorphin, dinorphin, enkephalin, these are acting to the opioid receptor. Endorphin through mu opioid receptor, dinorphin through the K opioid receptor, enkephalin through the delta opioid receptor. These are endogenous opioid peptides. They cause a morphine-like action, reduce the pain, reduce the feeling of illness, apprehension. And there is also one of the endogenous opioid peptide, nociception. Nociception nothing but a feeling of pain. Nociception is nothing but a feeling of a pain. Next. So the next question is split up of time cycle of cardiac cycle. So split up of time cycle of cardiac cycle. So let's have a look here. Okay, regarding the split of this cardiac cycle. So VS nothing but ventricular systole, VD nothing but ventricular diastole, AS atrial systole, and AD nothing but atrial diastole. So these are the options. So here, so A 0.3, 0.5, 0.1, 0.7, and next B 0.5, 0.3, 0.7, 0.1, next C 0.3, 0.5, 0.5, 0.3, nothing but VS is 0.5 seconds, so 3 seconds, 0.3 seconds, and 0.5 seconds. So the answer is here, the split up of time cycle of cardiac cycle. So the split up of cycle of the cardiac cycle, the answer is the option A. Option A is the answer. So let's have a look here. So what is simply atrial diastole, atrial systole, isovolume contraction, or ventricular ejection, as well as isovolumic relaxation. Isovolumic relaxation. Next. So regarding the next question, it is about Vigabatrin. Vigabatrin produces anti-epileptic activity. Vigabatrin, if you observe the name itself of Vigabatrin. So Vigabatrin, VI, vinyl GABA derivative inhibitor of GABA transaminase. IN inhibitor, TR transaminase. That is Vigabatrin is a vinyl GABA derivative inhibit the GABA transaminase enzyme. GABA transaminase enzyme is responsible for the metabolism of GABA, inactivation of GABA, inhibition of GABA transaminase enzyme, increase the GABA levels essential for treatment of epileptic patient. Essential for the treatment of epileptic patient. So, what is the mechanism of action of Vigabatrin? Vigabatrin potentiates GABA-mediated neuronal inhibition by depressed GABA transporters, modifying synaptic release of glutamate or GABA by binding to specific synaptic protein, inhibiting GABA transaminase enzyme which degrades GABA, potentiating postsynaptic GABA receptor effect. Potentiating postsynaptic GABA receptor effect. So, vigabatrin produce anti-epileptic act through potentiate GABA-mediated neuronal inhibition by depressing GABA transporter. No, modifying synaptic release of glutamate, inhibiting GABA transaminase enzyme which degrades the GABA. So, vigabatrin, vinyl GABA derivative inhibit the GABA transaminase enzyme, decrease the metabolism of GABA, increase the levels of GABA, but helps in the treatment of epilepsy. Helps in the treatment of epilepsy. So, the answer is option C. Answer is option C. As I mentioned earlier, it is a vigabatrin. Vigabatrin is a vinyl GABA derivative. It is a vinyl GABA derivative. Inhibit the GABA transaminase enzyme responsible for GABA inactivation by the inhibition of GABA transaminase, decreasing the levels of GABA. Decrease the metabolism of GABA, increase the levels of GABA. It leads to increasing inhibitory neurotransmission, helps in controlling epilepsy. So the epilepsy is due to excess excitatory neurotransmission, decreasing function of inhibitory neurotransmission. That's why in the treatment of epilepsy, we have to increase the inhibitory neurotransmission GABA glycine and to decrease the excitatory neurotransmission aspartate as well as the glutamate. Aspartate as well as the glutamate. So match the following. So like these questions are very interesting. Let's have a look on this question. Apoptosis, necrosis, anaplasia, neoplasm. So let's have a look on this question. So match the following questions. So like these questions are very interesting. So what is simply apoptosis? So apoptosis is nothing but generally we know that programmed flow. It is a program of cell death. Program of cell death. So necrosis is nothing but it is a irreversible cell death. Necrosis is nothing but irreversible cell death. Neoplasm is nothing but a new tissue. Nothing but neoplasm is nothing but a term of the cancer also. A term of the cancer also. So if you observe, so apoptosis, tightly regulated intracellular program in which destined cells to die. And next, two, necrosis is a progressive degradative action of enzyme. Necrosis, cell death due to degradative enzymes. Next, 3S. So that is lack of differentiation. Anaplasia. So anaplasia, lack of differentiation, decreasing the cell division capacity. And 4, neoplasm, abnormal mass of the tissue which may develop to the cancer, which may lead to develop to the cancer. So the answer is here option A. Option A is the answer. So simply 1, apoptosis is a tightly regulated intracellular program, that is a programmed cell death. So in programmed cell death, the cells may be died or may be reheal also. Next, necrosis, progressive degradative action of enzymes, cell death. Necrosis is irreversible process. Next, 3, anaplasia, lack of differentiation, decreasing the division capacity of the cells. 4, that is abnormal mass of tissue, neoplasm, may develop into the cancer also. May develop into the cancer also. Okay, so here difference between necrosis and apoptosis. Difference between necrosis and apoptosis. Necrosis is a unprogrammed cell death leads to the death. It is a programmed cell death. Non-useful cells may die. Damaged cells may again reheal. So necrosis in case of pathological diseased conditions, but apoptosis both physiological as well as pathological. So it is a general process and even process in the diseased conditions also. And generally it involves necrosis involves inflammatory reaction and apoptosis involves inflammatory reactions are not present here. And cell swelling is a common sign of the cell swelling is common in case of necrosis. It is an indication. And the cell shrinkage is the first change in the apoptosis. It is necrosis generally carried out by the some of the enzymes. Apoptosis is generally by the some of the genes. Some of the genes. So apoptosis is a programmed cell death, but necrosis is not a programmed cell death. Necrosis is a irreversible process may lead to death also. May lead to death also. So as I told all that anaplasia nothing but there is a lack of differentiation. They decrease the differentiation category. So there is a two types of cells. Two types of tumors. Malignant tumors. Okay. So there are mainly two types of tumors. Benign tumors as well as malignant tumors. So neoplasm is nothing but an abnormal growth may lead to the cancer tissue, cancer cell. Next. So let's have a look on the next MCQ. So which one of the following plexus is a part of central nervous system in the brain consists of capillaries, ventricles as well as ependymal cells. As well as ependymal cells. So here, which one of the following plexus is a part of central nervous system in the brain and consists of capillaries, ventricles as well as ependymal cells. So this question is related to the blood-brain barrier. At the blood-brain barrier, we will study ventricles, primary ventricles, secondary ventricles, and especially here, so one of the option is choroid plexus. The choroid plexus is involved in the formation of a cerebrospinal fluid. So cerebrospinal fluid is essential for the both brain as well as spinal cord, nothing but nervous system. So following the plexus is a part of central nervous system. The brain consists of capillaries, ventricles, ependymal cells. So celiac plexus, choroid plexus, cervical plexus, brachial plexus. Choroid plexus will be the answer. Choroid plexus also responsible for formation of a cerebrospinal fluid. The answer is the choroid plexus. So here, so the list of the table, what are the choroid plexus? So celiac plexus, cervical plexus, brachial plexus. So coming to the brachial plexus, they are situated deeply within the neck as well as shoulder. Okay, coming to the choroid plexus, they involve in the formation of cerebrospinal fluid from the blood plasma. From the blood plasma, cerebrospinal fluid is formed in the choroid plexus. And celiac plexus, complex neural structure encompassing both the sensory as well as motor neuronal constructions. Sensory as well as motor neural constituents. Next. So cervical plexus, first four cervical nerves. These are the part of first four cervical nerves. Monitor the safety of the new drug under actual conditions using large number of patients has been classified as clinical trials. Monitor the safety of the new drug. So new drug nothing but definitely the drug into the market. The drug is already in the market under actual conditions using large number of patients has been classified as so phase 3, phase 2, phase 4, phase 1. So according to observe the new drug already in the market and we are observing the effectiveness of the new drug in the market in large population. Definitely it belongs to the phase 4. Phase 4 is generally post-marketing trials. So once you completed preclinical trials in the animals, after that clinical trials in the human beings and you release it into the market. After releasing into the market also, post-marketing trials, phase 4 trials will be conducted. How the drug is going into the people, how it is showing effectiveness in large population, is how much percentage it is showing beneficial effect, what are the adverse effects, what are the new activities other than the existing use of the drug. So phase 4 is generally known as post-marketing trials, and phase 1 is initial, and phase 1, phase 2, phase 3, phase 4. Okay. So phase 4 nothing but post-marketing trials. The answer is the post-marketing trials. So phase 1, phase 2, phase 3. So regarding phase 0 is known as known as micro-dosing study. With the small doses, we are testing the drug in the patient. With the small doses, also he is getting allergic reaction. We will remove the drug into the patient. Phase 1 is human pharmacology and safety. Phase 1 is human pharmacology and safety. Phase 2, therapeutic exploration and dose ranging. We are exploring our therapeutic activity of drug and dose ranging. At which dose it is showing beneficial response, at which dose it is not showing beneficial response, it may showing side effects. And phase 3 is therapeutic confirmation and comparison. Therapeutic confirmation and comparison. And after that, approved by the regulatory body. And after that, phase 4 is post-marketing surveillance. Observing the drug effectiveness in the large population after entering to the market. After entering to the market. So drug discovery will take place. So first we have to identify some drug from the plant source, marine source, directly from the laboratory by synthesis. Are back from the bacterial source. So preclinical phase in the animals, after that clinical trials in the human beings, and everything will successful in the preclinical and clinical, go for the approval by regulatory bodies, and after that post-marketing trials. After that post-marketing trials. So studying in large population is post-marketing trial. So next question is, which among the following statement correct with respect to their mechanism of action? Respect to their mechanism of action. So sitagliptin or vildagliptin inhibit the dipeptidyl peptidase 4 enzyme. Dapagliflozin, canagliflozin, AMPK activators. Glevinclamide, glimepiride, alpha glucosidase inhibitor. Acarbozu, metformin, potassium ATP channel blockers. I hope you know the answer very easily. So acarbozu is a alpha glucosidase inhibitor. Metformin is a AMPK activator. Metformin chemically bicarbonate. Glevinclamide, glimepiride, they block the potassium ATP channels of beta cells. Pancreatic beta cells. Dapagliflozin, canagliflozin, they block the sodium glucose transporter 2 in the kidney and decrease the reabsorption of glucose into the body, increase the excretion of glucose to the kidney. So sitagliptin, vildagliptin, they inhibit dipeptidyl peptidase 4 enzyme. By inhibition of dipeptidyl peptidase 4 enzyme, they increase incretins function. Incretins are the substance. They increase the insulin release and decrease the glucagon release. Decrease the glucagon release helps in the treatment of diabetes. The answer is very easy. You know that. So the correct answer is sitagliptin, vildagliptin inhibit the dipeptidyl peptidase 4. By that it decrease the inactivation of incretins, increase the levels of incretins, increased incretins decrease the insulin levels, increase the glucagon levels, increase the glucagon levels. Next, so this is the classification of anti-diabetics. So enhances insulin secretion by potassium ATP channel blocker, DPP4 inhibition, overcome the insulin resistance, increasing the action of insulin in the body by biguanides, thiazolidinediones, decrease the carbohydrate absorption into the blood, alpha glucosidase inhibitor. And other category GLP-1 analog exenatide also cause weight loss. Dopamine agonist bromocriptine also decrease the blood glucose. Sodium glucose transporter increase the excretion of glucose to the kidney, decrease the blood glucose levels. And amylin analog pramlintide. So this is a simple picture on the detailed classification of anti-diabetic but hypoglycemics. Hypoglycemics or anti-hyperglycemic drugs. Next, the next question is which of the following is non-epithelial malignancy tumor? Which of the following is a non-epithelial malignancy tumor? So here, so the options are Navius, adenoma, lipoma, fibrosarcoma. Which of the following is a non-epithelial malignancy tumor? Non-epithelial malignancy tumor. Okay. So generally, so these questions are like from the basics of pathophysiology as well as anatomy, especially related to the cancer. So answer will be the fibrosarcoma. Answer will be the fibrosarcoma. So regarding here, the discussion, the answer will be the fibrosarcoma. So especially it is not an epithelial, it is a non-epithelial malignancy tumor. Malignant tumors are further classified into two types. Carcinoma which originate from the epithelial tissue, sarcoma which arises from the connective tissue. So generally carcinoma originate from the epithelial tissues. Sarcoma means they are not originate from the epithelial tissues. That's why wherever you may see sarcoma, it may be fibrosarcoma, some other sarcoma, they are not generated from the epithelial tissues. They are not from the epithelial tissues. That's why they are known as the non-epithelial carcinomas, non-epithelial cancers. And here it is the different types of classification of cancers. So different simply between epithelial tumors, non-epithelial tumors. Okay. Next question is conversion of pseudo-stratified columnar epithelium in chronic bronchitis and bronchiectasis to columnar type of epithelium is example of which type of metaplasia? So conversion of pseudo-stratified columnar epithelium in chronic bronchitis and bronchiectasis to the columnar type of epithelium, pseudo-stratified columnar epithelium to columnar type of epithelium. This type of metaplasia is known as so options are like squamous metaplasia, columnar metaplasia, osseous metaplasia, cartilaginous metaplasia. So by seeing the option itself and the question itself, you know that which type of metaplasia it is. So simply here observe. So columnar epithelium and columnar type epithelium. So it is a columnar type of metaplasia. So changing from one form of tissue to the another form of the tissue. The answer is columnar type of metaplasia. Next, regarding metaplasia. So regarding the metaplasia, defined as reversible change of one type of epithelial or mesenchymal adult cells to other type of adult epithelial or mesenchymal cells, usually in response to abnormal stimuli, often revert back to normal on removal of the stimuli. So nothing but here simply one type of tissue is changing to other type of tissue, that is metaplasia, changing from one stage to another stage. Pseudo-stratified columnar to columnar epithelium type. So let's have a look on the next question. So what is the next question here? Long-term use of thiazide diuretics in hypertension can produce all of the following except. So generally hypertension is nothing but hypertension means excess blood pressure. That excess blood pressure is because of excess fluid volume in the body. So long-term use of thiazide diuretics in the treatment of hypertension may produce all of the following except hyperkalemia, increased potassium, hyperuricemia, hyperlipidemia, hyperglycemia. Yes, hyperglycemia, increased blood glucose levels, hyperlipidemia, increased lipid levels, hyperuricemia, increased uric acid levels, hyperkalemia. Generally, long-term use of thiazide diuretics may develop hypokalemia, decreased potassium. The drawback of loop diuretics, thiazide diuretics, they produce hypokalemia, decreased potassium. Due to decreased potassium or hypokalemia, develops muscle weakness and also develop cardiac arrhythmias. Hypokalemia is a drawback of thiazide diuretics as well as loop diuretics. That's why loop diuretics, thiazide diuretics should combine with potassium sparing diuretics to neutralize the hypokalemia of thiazide and thiazide like diuretic. Potassium diuretics, they spare the potassium in the body and eliminate the excess sodium only. But loop diuretics, thiazide diuretics eliminating the sodium and also eliminating the potassium. Due to severe loss of potassium due to excess usage of thiazide diuretics, it may produce hypokalemia but not hyperkalemia. Hyperkalemia is not a part of side effect of our thiazide diuretics. Answer is the hyperkalemia is not a part of adverse effect of thiazide diuretics. But even thiazide diuretics are not used in young males because they decrease the reproductive capacity of young males. They may produce gynecomastia, abnormal enlargement of breast in the males that leads to gynecomastia, that is impotence also, decrease the effectiveness of their reproductive capacity, sexual capacity. Okay, thiazide diuretics, loop diuretics commonly cause hypokalemia. Hypokalemia may develop muscle weakness or muscle fatigue. Also develop cardiac arrhythmias. Also develops a cardiac arrhythmia. Total number of facial bones in the human adult. So this is very very interesting question. So this is a basic question. I hope you know the answer for this. MCQ is. So generally the number of facial, 14, number of facial bones in the human adult will be the 14, 14. Number of facial bones in the human adult will be the 14, answer will be the 14, facial 14. So let's have a discussion here. So let's have a discussion. Bone is the hard part of the body providing framework to it. And generally there are 206 bones in the human body, you know that. And the skull consists 8 cranial bones, 14 facial bones. They are like inferior turbinative, lacrimal bones, mandibles 1, maxilla 2, nasal bones 2, palatine bones 2, vomer 1, zygomatic bone 2, 2. Okay. So facial bones are 14 facial, 14 facial. So this is a detailed picture. So axial 80, appendicular 126, axial axis 80, and appendicular 126. And again this axial skull, sternum, ribs, vertebral column, and again appendicular girdles, limb bones, bone of the forelimb, bone of the hind limb. So come to the next MCQ. Regarding the next MCQ, the beta 1, beta 2 adrenergic receptor subtype agonist acting at atrioventricular node produce following response. Beta 1, beta 2 adrenergic receptor subtype agonist acting at atrioventricular node producing following response. So stimulation of beta 1 increase contractility, conduction velocity, increase automaticity, conduction velocity, increases contractility, automaticity, increase conduction velocity as well as the heart rate. So beta 1 receptors are generally located on the heart. So stimulation of beta 1 receptor causes contraction of cardiac muscle. So respectively, stimulation of beta 1 receptors as well as beta 2 receptors produces which of the following activity. So simply the answer is increasing automaticity, conduction velocity, increasing the function of SA, sinoatrial node, and increasing the conduction velocity, automatically increasing the cardiac output, increasing blood flow to the all body parts. So increasing automaticity as well as increasing conduction velocity. So here alpha actions and beta actions. So alpha actions, especially alpha 1 receptor located in the blood vessel, binding of noradrenaline to alpha 1 receptors, produce vasoconstriction. Excess stimulation of alpha 1 receptor increase the blood pressure and hypertension. So alpha 1 blockers are antihypertensive drugs. Stimulation of alpha 2 receptor helps in the treatment of hypertension. Alpha 2 receptors are autoreceptor, decrease release of noradrenaline. Beta 1 receptors are located on the cardiac muscle. Stimulation of beta 1 receptors may lead to increasing automaticity as well as may lead to increasing the cardiac output. So here if you observe, so simply what is the role of alpha receptors on the different body parts as well as beta receptors on the different body parts. So these basics you already studied in the peripheral nervous system of anatomy, sympathetic, parasympathetic differences, as well as in the pharmacology of autonomic nervous system also you will study structural organization and functional organization of sympathetic and parasympathetic, their respective receptors and respective organs, their functions. Let's have a look on the further MCQ. Which of the following is a competitive antagonist at benzodiazepine site of GABA receptor gated chloride channel? Which of the following is a competitive antagonist at the benzodiazepine site of GABA receptor gated chloride channel? So benzodiazepine receptors agonized by GABA. So GABA is inhibitor neurotransmitter. GABA stimulants are benzodiazepines, barbiturates, antiepileptics, etc. So Muscimol, flumazenil, picrotoxin, beta-carbolin. Beta-carbolin is an inverse agonist at GABA receptors. Picrotoxin block the chloride site of GABA, decrease the function of GABA. Muscimol also a GABA receptor agonist, but here it is a competitive antagonist. Especially flumazenil is an antidote for overdose of benzodiazepines by decreasing the function of GABA or antagonizing the GABA action. So flumazenil is a competitive antagonist. Flumazenil is a competitive antagonist mainly for treatment of benzodiazepine overdose. Mainly for treatment of a benzodiazepine overdose. So GABA A, so GABA receptors. GABA receptors are three types: GABA A, GABA B, GABA C. GABA B, G protein coupled type. GABA A and C are ion channel or ionotropic type. Ion channel receptors are also known as fast acting receptors. Fast acting receptor. And here you can clearly go through it. So GABA A receptor is ligand gated or ion channel. GABA B is a G protein coupled receptor. GABA B receptor agonist is baclofen. So baclofen is an agonist at GABA B receptor, and saclofen is an antagonist at GABA B receptor. Barbiturates, benzodiazepines, beta-carbolin, maximol, they are all are agonist at GABA receptor. Dicuculin is also antagonist. Clomazenil is an antidote for benzodiazepine overdose. Decrease the function of benzodiazepine at GABA receptor by opposing the GABA function. Here, GABA increase the duration of channel opening and increase in the chloride influx into the CNS cells. Picrotoxin, natural from the plant source, block the Cl minus chloride site of the GABA, decrease the function of GABA. Picrotoxin is a CNS stimulant by decreasing inhibitory neurotransmission GABA function. So let's see the following MCQ. So some individuals are obsessed with using purgative regularly as a reflection of their psychological problem. Danger of purgative overuse include all of the following things. So some of the people will obsessed. They're not interested to use purgatives continuously. Purgatives are nothing but these are drugs for treatment of constipation. They are used to eliminate fecal matter by increasing the softness of fecal matter. Easy evacuation of bowels. But what are the simply danger of the purgatives include all of the following except. So what are the dangerous effects observed because of continuous use of purgatives? Purgatives. So here options you can observe. The options are flaring up of intestinal pathology like rupture of inflamed appendix, fluid and electrolyte imbalance, especially hypokalemia, steatorrhea, malabsorption syndrome, protein buildup in the body as a result of enteropathy. So all of these following are drawbacks of excess usage or continuous use of purgatives except. So flaring of intestinal pathology like rupture of inflamed appendix. So that is will be there. Fluid and electrolyte imbalance will be there. Steatorrhea, malabsorption syndrome will be there. Protein buildup in the body as a result of enteropathy also there. Enteropathy. So entero nothing but intestine. So protein buildup in the body as a result of enteropathy is not a remaining are the drawbacks of overusage of the purgatives. Purgatives are drugs helps in the treatment of constipation. They helps in the removal of fecal matter. Sometimes because of constipation it is hard to remove fecal matter, but these drugs help to remove the fecal matter easily. So the answer is protein buildup in the body as a result of enteropathy, not a part of dangerous effect of overuse of purgatives. Next question. So have a look on the next question. Which of the following is wrongly matched combination of anti-arrhythmic drugs and their class? So anti-arrhythmic drug classification: class 1, class 2, class 3, class 4 and miscellaneous category. So class 1 anti-arrhythmics are generally sodium channel blockers, class 2 anti-arrhythmics are beta blockers, class 3 anti-arrhythmics are potassium channel blockers, class 4 anti-arrhythmics are calcium channel blockers. So identify the mismatch here. Lidocaine class 1B, disopyramide class 2 antiarrhythmic, diltiazem class 4, amiodarone class 3. So amiodarone is a potassium channel blocker class 3 antiarrhythmic. Diltiazem is a calcium channel blocker class for antiarrhythmic, and disopyramide is not a class 2 antiarrhythmic. Lidocaine will be the class 1B antiarrhythmic. All class 2 antiarrhythmics are beta blockers, propranolol, atenolol, metoprolol. So the question is very easy, very simple. You can answer easily also. So disopyramide is not belongs to class 2 antiarrhythmic. All class 2 antiarrhythmics are beta blockers. Class 1 membrane stabilizing agent block the sodium channels. Class 2 are beta receptor blockers. Class 3 prolong the duration of action potential by blocking the potassium channels. Class 4 calcium channel blockers. Miscellaneous category of drugs nothing but class 5 antiarrhythmics. Drugs for treatment of PSVT, paroxysmal supraventricular tachycardia, where the heartbeat is more than 200 beats per minute, more than 200 beats per minute. So let's have a look on the detailed classification of antiarrhythmics based on their class 1, 2, 3, 4 under miscellaneous category. Which one of the following calcium channel blocker used as a anti-anginal agent has the highest possibility to produce negative inotropic effect? Negative inotropic, decreasing the number of contractions of heart. So, block the AV node, may produce bradycardia, decrease number of heartbeats, decreases cardiac output from the heart, may lead to constipation, edema, contraindicated in the sick sinus syndrome. Contraindicated in the sick sinus syndrome. So apart from all this, generally constipation is one of the drawback of verapamil because verapamil decreases the calcium availability in the gastric smooth muscle. It may lead to constipation. Decreasing calcium in the gastric smooth muscle, decrease the gastric movements. Decreasing gastric movements may develop the constipation. So constipation is one of the drawback of verapamil. So let's see. So nifedipine mainly acts on the blood vessel. Amlodipine mainly acts on the blood vessel. Diltiazem, it is having action on heart, but verapamil is highly selective action on heart as a calcium channel blocker. So calcium channel blocker. Verapamil is highly selective calcium channel blocker acts on the heart. So the answer is verapamil. The answer is verapamil. So action of verapamil decrease the contractility, that is negative inotropic, decrease the number of contractions, decrease the conduction velocity, decrease the blood pressure, produce bradycardia, may block the atrioventricular node, may produce headache, may produce constipation also. Especially due to decreasing the calcium concentration in the gastric smooth muscle, it may produce a constipation. May produce a constipation. Next, prostaglandin analogs. Prostaglandin analogs have therapeutic utility in the following except importance of peripheral vascular disease, palliative treatment of patent ductus arteriosus, as well as pulmonary hypertension. Prostaglandin analogs are having many applications. Prostaglandin having analogs are having many applications, but exception will goes to the palliative treatment of patent ductus arteriosus. Palliative treatment of patent ductus arteriosus. So here, pharmacological actions of or uses of prostaglandin. They having negative effect on the platelets, blood vessels, uterus, and action on the bronchi, GIT, eye, male reproductive system, as well as many functions of prostaglandins. So this is the picture indicating the role of prostaglandins in the human body. Role of prostaglandins in the human body. Okay, so this is regarding our session of discussion of pharmacology MCQs with detailed explanation from the Gpat 2021 question paper. So please once go through, if you already go through also once go through the previous year 2024 Gpat question paper shift 1, shift 2 given by the new board MBMES, a medical board. So observe how they are giving the question, from where they are giving more questions. So follow that, it may be helpful. And you are at the end of your GPAT preparation, so please be confident, please be stabilize yourself, stick to the reality, put your efforts in both hard work as well as smart work. So whatever you are doing since 1 year, 2 year or 6 months, it is not matter. How you are going to perform on the 3 hours is the matter. So stabilize your psychological system, be prepared. So you are the generation, you are not for the winning hearts, you have to win the game. Only option for your generation. The old generation is gone. They are for winning hearts. They strive hard, but not in the course of the winning. But you are the generation. You are not for the winning hearts. You are not for working continuously hard at the end. You have to work hard until the end. You have to win. You are not for winning the hearts. Okay. So definitely you are doing well. So do it well. Make it continuously doing what you are doing for regarding your preparation. If you are really feeling frustration, maybe you want some relaxation, enjoy it. Do it for 1 or 2 hours. But put your 100% to get a good rank. So GDC is always with you. So follow our MCQs and understand why particular is wrong and why particular is right. So you have to filter yourself. So thank you so much for always believing in the GDC. Definitely you will get good results. So trust yourself, trust in yourself and go for it. Okay, all the best.